Hi, and welcome back to another AI in 5. I'm your host, Simon Chris, and joining me today from Dallas is Dr. Elise Victor. Now, Elise is board certified in AI in medicine, and she runs a home health business. And we're going to be talking about the use of AI by clinicians. Hey, Elise, welcome to AI in 5. Thanks for joining us.
Hi, Simon. Thank you for having me.
Now, I've been super excited about this one coming up. You're the first person I've met that is actually board certified in AI. And the fact that that happened back in 2021 just shows that, we've been using AI in medicine for quite a while. The one thing I wanted to hit on, and we've talked about it before, is this thing about practitioner burnout. My daughter is a nurse, and I absolutely see it in that kind of burnout stuff. What are you seeing around there, and how's AI helping?
Yes. So clinician burnout has been growing and a real problem in medicine. We have had, as I shared with you before, interesting statistics related to, how even students, currently medical students, roughly a third of them are already thinking about how they can exit practicing medicine.
Wow.
And it's sad. I run a home health agency, so I have nurses and clinical staff, and I interview people all the time. And one of the biggest things that I hear from them is that they left, whatever position it was, or they want to leave because they're in a hospital setting and it's just incredibly taxing, and it's a real, grind for them, and they can't even practice medicine and care for the patients the way that they want to, which is why they went into the field in the first place.
So how's AI helping?
So right now, what the biggest thing that I think is helping that is the ambient listening. So that is basically AI-powered technology that is able to listen to the patient if a physician or clinician's interacting with them and help with the bedside, the documentation, notes. And that's one of the things that is really difficult for, and has been for years. I used to work for a payer, and my role was actually working, this was, probably 8 years ago, was working with all of the primary care physicians in the state. And even at that time, they couldn't keep up with, quality things, charting, that, and it's done nothing but grow. And so with the ambient listing, there's roughly a third of healthcare organizations are now implementing this. This is something that we're bringing into our agency as well. And we will have, hopefully, with our implementation, potentially a 30% reduction for our clinical staff that are going out. So physical therapists, registered nurses, LVNs, and when we're working with the patient, a 30% reduction in what they have to do when they leave and go chart. And it gives them the ability to interact more directly with the patient because they're able to make eye contact, not so worried about charting. So if the ambient listening can be there and capture all of that, it frees them up to care for the patient, right? In their 1 or 2 hour session, which is, the time that they're spending to provide that hands-on bedside care.
And I imagine they're tracking more today than they ever have before anyway, because, we can measure so many more things.
Absolutely. So as you said, I'm board certified AI in medicine. I've been involved with this organization. A friend of mine, he's a pediatric cardiologist, started this about a decade ago. And I was at his conference this past fall. And this was one of the topics that we just kept hearing about. And a statistic that shocked me and has really stuck with me is they shared that roughly 50 years ago in an ICU bedside setting, there were about 7 data points to track for a clinician.
In ICU,
today,
only 7. Okay.
Yeah, so 7 data points. Now today, fast forward to 2025, and it's about 1,300. So the cognitive load that puts on a clinician is just, it's mind-boggling. So we need AI. We're going to see AI in these healthcare settings to help manage the patients and ultimately provide the quality of care that, patients deserve.
Look, believe it or not, we're already at time, and I feel like this could be a 3-hour podcast. Before you go, I love to ask everybody the same question, and that is, what would be your best tip for an organization, a company that is just starting their AI journey? What should they think about?
I think they should think about what they ultimately want to do with AI in their longer term goals. And I think what's important is, when companies look at implementing AI, they think, okay, well, we need everything. Well, I think it's important to step back and think about what the big picture is. So for healthcare, right? Most everyone's going to say it's the patient. So what is going to provide the best patient experience and also give that company the ROI on that AI investment, right? And also starting small. Please start small because you just need to get those small wins.
That's great advice. Thank you so much for being a part of AI in 5, and I look forward to chatting again soon.
Wonderful. Thank you so much.